Hi, everyone, and thank you for joining us today for our SRC Accreditation Overview. I am Alex Wakehoff, and I'm the Director of Business Development at SRC, so I work closely with physicians, nursing staff, hospitals, anyone who is looking into accreditation and wants to find out more about the process and our requirements. So I'm going to be going through some information about our company, our accreditation programs, the process to become accredited, as well as some of the benefits. And then we have Larissa Jacobson on the call as well. She is our marketing manager, and she will be discussing our designee services. She'll introduce herself a little further when we get to her section of the presentation, but I'm going to go ahead and get started for all of you. So a little bit about SRC and our history. We are an independent nonprofit organization. We have been protecting patients for over 20 years. So we do have a long history with doing surgical accreditations. And being that we are a global company as well, we have gotten a chance to see best practice from around the world, and our clinical team of inspectors are able to bring that to all of the facilities that pursue accreditation with us. One of the things that is important about us being an independent and nonprofit organization is that, first of all, we take a consultative approach to our accreditations. We have the ability to do that. And second of all, patient safety truly is our main priority, as we know also is those that pursue our accreditation. Again, we are a global company, so we are currently having SRC accredited providers in over 25 countries. A little bit about the programs that we offer as far as accreditation goes. The one that we see most people pursue and that you yourself might be on the call interested in is our Center of Excellence Accreditation. And that is accrediting a medical facility as well as surgeons that practice at that facility. So surgeons of excellence will get accredited with a Center of Excellence and have their names distinguished in that accreditation. I do want to mention also, as we're going through this PowerPoint, you'll see at the top of your screen, there's a chat option, and you can click into that chat and send a message at any time. We'll get to it either as we're doing the presentation or during the question and answer portion at the end. So as we're going through anything, please feel free to send a message over. The next program we offer is Master Surgeon Accreditation, and this is a more individualized accreditation for physicians. There is a higher volume requirement for this as compared to Surgeon of Excellence, and this is something that a surgeon can carry with them anywhere they're practiced. They get much more individual support from our designee services team, specifically our marketing team, should a surgeon pursue this. And you can be both. You can be a surgeon of excellence and a master surgeon. Master surgeon on their own does not have to have a hospital participating in accreditation with them. So if you are a physician and you'd like to become accredited but don't have support from the hospital you're practicing at, this would be a great option for you. We also offer a care specialist accreditation, and this is for that support team, allied health members on your team. We offer this as an add-on to a center of excellence, so you should be a center of excellence in order to get this package, and you would be able to award 10 or more of your allied health members with this care specialist distinction. What's great about that is, as a patient, if I see that the whole nursing staff has this seal on their lab coat, if this is advertised all over, then I know that even the nurses, anyone who I see during my experience at your facility, has undergone an inspection by SRC and is an expert in giving care to me as a patient. And then finally, we offer a Network of Excellence title. This is something we give when 3 or more facilities that are in the same healthcare system pursue the same accreditation program. There is a lot of benefit to pursuing a Network of Excellence accreditation from a system level. You don't have to have hospitals pursue this individually. If you work for a larger health system and you feel that it would be beneficial to get all, let's say 5 hospitals accredited in the same program with SRC, we can work with you and also customize our program to really make sure that you are getting what you want on a system level. Benefits of this for a patient, again, is standardization of care. I know that no matter which facility I go to under this health system, they're going to give me the same standard of care. When we talk about what to expect from an accreditation, not just an SRC accreditation, but any, and some of those more popular ones that you would be used to working in healthcare, oftentimes that comes with the idea of stress and a lot of work. So the very first thing we want to make sure you understand about SRC is this, as much as it can be, we want it to be stress-free for you. We, as I said, take a consultative approach. We are not a pass or fail organization. There are not wrong answers to give SRC when you're going through the accreditation process or the inspection process. We truly want to learn about your surgical program and about your hospital, and then provide our expertise to help improve on what you're doing, to help meet any goals that you have, and really importantly, to recognize what you're already doing. We also have an ongoing partnership within our accreditation. Just because you finish an inspection and you get your seal that says you're a center of excellence, we don't walk away at that point. As I mentioned, we'll be going through what our designee services are that we offer, and we really encourage that everyone who's accredited with us takes advantage of those designee services. In order to meet your goals, in order to maximize the benefits of an accreditation, you need to utilize us. That's what we're here for. And of course, there's benefits that everyone's familiar with that comes with accreditations, not just an SRC accreditation, but others that are out there. What's nice about SRC is we customize your entire experience. So everything is tailored, as I said, to meet your needs, your goals. Why are you pursuing this accreditation? We want it to be worth your while. Something that our inspectors like to say, and again, just really letting you know that we don't want this to be stressful, is they don't have red pens. So again, there's not a pass or fail moment with us. We're here to give you our recommendations and input on improving your program. So talking a little bit further about the benefits of an SRC accreditation specifically, and these benefits that we talk about have been verified by our designees, those that are already accredited. And I think you look at the theme of some of these benefits, and again, it's things that you may be familiar with and that you already may be pursuing other accreditations to see this. Getting a team effort, working as a team to pursue this accreditation and to finish your inspection process with SRC is one of the biggest benefits we hear from our designees. And I always want to make sure that we talk about that, because a lot of times, it is a team effort, and a lot of times some of your team might be overlooked as far as what they do. So we are making sure to recognize everyone and the impact they have on your program, on your patients at your hospital. We also know that as a surgeon, when you're in an operating room, you want to feel confident that whoever is in that room with you, supporting you, can provide the same support across the board. And that's something that this accreditation does for you as a surgeon and for you as a team. And of course, by becoming accredited, you're going to see an increase in volume. That's usually something that people do pursue. But I want to mention, we hear from some people who say, I don't need more volume. I'm booked out for the next 3 months. Well, what you probably then need is backtracking to that team, making sure there's standards across the board, making sure your policies and procedures are in place and that everyone is educated properly on how to follow those. So I do, from my perspective, working with many facilities and surgeons, I do hear many people hoping to see higher volume, but there is a flip side to that, and you can still see benefits if you are already a busy hospital or practice by becoming accredited. There's, of course, always a distinction with accreditation, and an SRC accreditation, because we've been around for 20 years and because we are able to accredit in many surgical specialties, there is a distinction and recognition of that, not just from other healthcare professionals, but also from patients. One of the things that we also recognize is going to be important to you as you are looking into accreditation or pursuing accreditation is the return on investment. So we do want to address that. Absolutely, we expect a return on your investment in an SRC accreditation. First of all, when you see improved patient outcomes, which again are a standard benefit of this accreditation, you're going to also see cost savings. We know that one complication has a high cost tied to it. If we can even bring down your complications by 5%, you're going to see a decrease in costs that you're spending at the facility. Again, with increased volume, if you're seeing more patients come in, that's going to affect your bottom line as well. We see patients with higher satisfaction when they visit a facility that is accredited. So less complaints that you hear and less risk management episodes are going to increase your profitability. And then finally, when it comes to reimbursement, when you talk about value-based healthcare, we know that accreditation can impact reimbursements from certain payers. So that is something our designees have reported that they've seen once they got an SRC accreditation, and we're always willing to help put together any information you might need to present to a payer to request that more favorable reimbursement. On the screen are just a couple of testimonials that I always like to share, especially when talking about that return on investment. One of the wonderful things about our SRC Centers of Excellence is that they are always willing to be a referral and talk to you, that are just now pursuing, to explain what their experience was like and what benefits they've already seen. So just on the screen, you can see from a couple of our facilities that they're talking about higher volumes, happier patients. So again, that's something that, we do hear directly from our participating centers of excellence. Now I'm going to talk a little bit about the accreditation process. I am hopefully, so far, you're already hearing some things that are different about an SRC accreditation than other accrediting groups that you may have had experience with in the past. Significantly, the fact that we are consultative, we're coming in to recognize what you're doing, to give our input on helping you improve or helping reach whatever specific goals you share with us. So this, without the stress, without the worry of I could possibly fail this, we also make sure that the entire process is something that we're guiding you through and, making it simpler for you. Our very first step in deciding that you want to move ahead with accreditation is registering for whichever surgical program you're choosing. If you're here with us today, I'm not sure if you've checked out our website. Some of you, excuse me, some of you may already be in contact with a business development representative. So you may have seen the list of programs that we offer. And by that, I mean surgical programs that we offer Center of Excellence accreditation in. We have, I think, over 30 programs by this point. Truly, any service line that you are considering getting accredited, we offer a program in that. So once you select which program or programs you'll pursue. That registration process that we have in place is really just getting our standard legal documents signed by your facility. And then, we do a standard business associate agreement as well, so that you feel that you're protected with any information you share with SRC. Once that registration is completed, we're able to set up your account, your hospital and surgeon accounts in our system, and give you your initial invoice. Our fees are annual. When you pay your initial invoice, which is what we call an application fee, you will get your first annual invoice 1 year from that day. So we do not begin our inspection process until you make your initial payment. And as soon as you do, you are connected with someone from our program support team to really help guide you through the inspection process itself. They will help you prepare, and they will be giving you detailed instructions on how to complete the inspection process. Our inspection process is split into 2 parts. The first is document submission and document review, and the second is an on-site facility assessment, where an inspector will actually come in and tour your facility, meet with your team. So we will review all of your documentation before we plan to come in for that in-person visit, and that is not a surprise visit. We talk to you and make sure it's a convenient time for you to have someone from SRC come in and complete the facility assessment. That piece is also a really wonderful time for everyone on the team to get recognized again by SRC, but to also, ask questions in person to our clinical experts. I will tell you again, trying to make sure you understand that we pride ourselves on the way we do our accreditations. All of our clinical team members who would be visiting you to do a facility assessment have surgical experience. So they have been in an operating room, they have worked at hospitals from varying levels within a hospital. So essentially, they've been in your shoes. And again, they're not there to critique or criticize you. They're there to share their experience and expertise from being on your side of things, also from touring hospitals around the world. Once you complete this inspection process, and that, as I said, that second piece being the facility assessment, that's when you are officially accredited as a Center of Excellence, Surgeon of Excellence, Master Surgeon, whichever program you're pursuing. And then in order to maintain your accreditation, we do those inspections every 3 years. The process 3 years down the line is not going to be identical to what you've gone through on the day of. But, we will be getting updated information from you, and again, seeing how far you've come over the 3 years and how we can continue to support you moving ahead. Our program requirements for every single Center of Excellence program, no matter which surgical specialty it is, are the same. We have 10 pillars of excellence, and there are just some varying, changes, varying information depending on which specialty it is. So the 10 that you see listed on the screen are pretty standard across the board. 9 out of these 10 are documents. So as I said, we start our process with reviewing documentation, and that's done virtually. You don't have to prepare to have someone sit in a room with a bunch of binders to review that. We will set you up to send that all in electronically and have a virtual review. The other nice piece about that is if our inspector does have questions on any of the documents or have recommendations right away, they will give that to you and give you, time to turn around and make those changes. So just to explain very quickly these program requirements, when we talk about an institutional commitment to excellence, we want to know that as a hospital, you're supporting this surgical team with funding education, whatever it may be. When we talk about surgical experience, we actually will review case detail. We provide you with an Excel template that shows which data we need you to pull on your cases for whichever program you're pursuing. You will have a volume requirement, an annual volume requirement as a facility, and then as a participating surgeon who would become a surgeon of excellence, you will have both an annual and lifetime volume requirement. The important thing about this piece, this case list that we collect, is that we also select charts based on the case review. So you'll pull this list together and the inspector, when they receive it, will select charts that they'll ask you to then pull. The other thing I always like to mention with this is that we do not look at any identifying information of patients. So we ask that this is de-identified as much as possible so that we are not seeing any critical information about a patient. In this program, you do have to assign someone to be your physician program director, and that is going to be a surgeon who's also becoming a surgeon of excellence. They're participating in accreditation with you. Your consultative services depend on which program you're pursuing, and that's something that we just want to see a list to know that a patient can get this service should they need it, should there be an emergency or an adverse outcome, if they need something else other than their primary surgeon, that you have that available, whether it's on site or through a transfer protocol. The one requirement on here that's not a document is equipment and instruments. That's something that the inspector checks when they're there in person for the facility assessment. And then we also ask for more detail on your other surgeons, covering surgeons, the surgeons who will become accredited. We want to make sure they're keeping up with their education through CMEs. You know, of course, that they also have privileges at your facility. We ask that you have clinical pathways that show SRC what the patient experience is when they come to your facility. And that's also something we want to make sure all of your surgeons are aware of, as well as your support staff. We have you put these clinical pathways together, but we also do that for you to have a new resource at your facility, a place that if I'm covering for someone or if I'm new staff, I know that I can reference this document, that these pathways, and know exactly what to do next with the patient. And then, as I said, we look at your entire team. So we also want to know about your support staff, your nursing team, who is a part of that patient experience. We ask for their names and their titles, as well as making sure that they're getting continuous education through in-services. We want to ensure that patients are being educated properly by your hospital as well as by physician practices. So we ask you to submit some examples of the patient education that they may receive from, pre-op, post-op instructions. If there's links that you send them to videos to explain more about the procedure that they'll be having done, we like to look all of that over and also, as I said, really support you. It's pretty staggering how many patients really do not feel educated on healthcare terminology, on even things that they're agreeing to. And so SRC makes it a priority that you're providing excellent education to your patients. And then finally, for continuous quality assessment to occur, as I mentioned, we do inspections every 3 years, and you will need to submit case information every 3 years. So we just want to ensure that when that time comes, you're able to provide us with the same case information that you will do initially, so that we can review your outcomes again and see how you've improved over time. So we're going to talk further about the designee services, and truly this piece is what absolutely is the SRC difference. With other accreditations, we guarantee you won't get the custom support that you do from our designee services, and it is extensive and really useful for you. So I'm going to switch over to Larissa at this time. She'll introduce herself and walk you through those designee services that we offer.
Hi, everyone. My name is Larissa Jacobson, and as Alex said, I am the marketing manager for Designee Services. Before we dive in, I just am really curious to see where everyone is joining us from today. So I'll go ahead and start. And if you want to put in the chat just right above you, that little speech bubble, just put either your state or your country where you're joining us from. I am coming to you from Pennsylvania today. So I'll kick it off if everyone wants to throw that in there. It's always interesting to see, oh, New York. Oh, hi, neighbor. Okay, fantastic.
Wow, we have a lot of places joining us. That's great.
Too. Oh, this is wonderful. One of the really amazing things with SRC as well is that we are kind of all over the states. So we are all able to kind of see the nuances in those different geographical healthcare landscapes as well. So that's really fantastic. Oh, Puerto Rico, wonderful. Thank you guys so much. Thank you for joining us. Super excited to have you here. So we'll dive into our designee services. Our designee services sort of covers a realm of different value-based services. Most of these things that we're going to talk about are actually included in your accreditation fees. So like Alex mentioned, there is an annual fee, both the centers of excellence, well, master surgeons, but the services that you are going to get really mitigate that cost over and over again. And we'll talk about some of those in a minute here. Our designee services were really developed to continue that partnership and to fill the need. We didn't want to be like other accrediting bodies where we're just kind of like, here's your gold star and bye. This is really a collective effort to raise the bar on healthcare standards around the world so that patients are getting expanded access to high quality care, so that we are able to support our designees in maximizing the value and driving patients to them. Because again, as a patient-centered organization, we want to make sure that the patients are top of mind and that they are able to easily access and find these accredited providers like yourself who are doing amazing things. So with that, we do provide in support in marketing communications as well as quality improvement. We will have consulting and education coming soon, so that is in the works, and we are continuing to expand our service support to make sure that we are really providing the value and meeting your needs. And we kick
Also, I do want to mention, sorry, I'll probably pop in a few times, Larissa.
yeah.
I with SRC, again, just us taking a different path to accreditation, we are very responsive to your feedback and to our participants' feedback. So when we talk about that, we're currently developing consultative and educational services. That's based on what we hear from our participants that they're looking for and can't necessarily find that exact piece to the puzzle. And so at any time, whether it be, during the inspection process or after you're accredited, we hope to hear from our participants to tell us, here's where we think you could support us further, and we will chase after that for you.
Perfect. Where we really kick things off is once you are accredited, you will receive your own account manager. And this is kind of going to be your SRC guru, if you will, right? So they're going to be that point person that's going to connect you to the right individuals to provide solutions for your needs, whether that be you're starting a new policy or process and want to get some feedback from our clinical experts, or you want some marketing support. Then your account manager is going to be able to connect you and follow up with you to make sure your needs are being met, to make sure that everything is going well. And of course, like Alex just said, to find out if you have any feedback for additional services that would be really beneficial and helpful to you. So you will be provided that. And then as far as the marketing support goes, how many, and we're going to use the react button for this one. So if you just give me a thumbs up with the react button up there at the top, how many of you are marketing ninjas yourselves? Okay. Got a couple coming in. Yeah. Fantastic. So for those of you who know and understand marketing, you know how important it is. And when we talk about marketing, having the accreditation is wonderful. You're doing the amazing work. You've been validated through the SRC accreditation for what you're doing. But if we're not marketing it, then the tree just fell in the woods and no one heard it, right? So we need to be able to make a sound. So our marketing healthcare experts are here to really help you maximize that accreditation through that storytelling, through design and production, and really get that return on value that you're looking for. Where things kick off is once you're accredited, we will send you certificates that you can then display on your walls and your offices. You will be provided with posters that are specific to your accreditation, as well as brochures so that can kind of get you out the gate, start educating patients and staff on these things. Surgeons will receive, whether they're a surgeon of excellence or a master surgeon, it'll be specific to that. They'll receive patches for their lab coats as well as lapel pins. And again, these are really good identifiers and conversation piece starters to really wear with pride and can elicit that kind of from patients, what is that seal? What does that mean? And so that you can really have a conversation around that. Additionally, we do provide a very robust digital marketing kit, which will include all of your seals. It will also include templates to just get you started that you can manipulate in your brand and everything. And so that's just kind of out the gate, right? So after that, we really meet to kind of tailor things down to you and your organization and what those needs are. So we will do sort of a needs-based assessment with you, and we'll talk about kind of where your goals are. Where do you want to go with this accreditation? What do you want to see happening? Do you need to create a more robust digital presence? Do you want to work on a social media campaign? Do you need to have printouts for your physician liaisons, things like that? And so we'll really find out where the need is. And then from there, we go on more customized project specific basis, right? Unlike other organizations, we do branding differently. So a lot of times when you're branding with another organization, it's kind of like, yeah, I'll make it look and feel like us, and then I'll put your logo on it. That's not really valuable. So it is extremely important to us that we are maintaining fidelity to your brand standards. So anything we would work on with you or partner with you to create, it would look and feel like your brand, and then it would have your accreditation seal on it. We do love to promote our designees on our own social media and digital channels. And again, this is sort of expanding that awareness for you. We like to highlight any milestones, achievements. We have some that just hit like 5,000 robotic surgeries, and we want to know about it, and we want to talk and share about it too. So we do a lot of recognition and outreach from our end, as well as helping create custom pieces for you to do recognition and outreach on your end, whether the goal is to bring in more word of mouth patients or maybe expand your provider network. Definitely, educating internal staff on the accreditation, we can really help you with those efforts as well. We do have a find a provider tool. So if you've been on our website, it is really easy to utilize that to find a provider in your area that is accredited in what you're looking for. It also lends credibility to our designees. So that way they can be vetted that, yes, they are accredited. We have a way to showcase that. So Alex mentioned that master surgeons do receive some additional supports. Surgeons of excellence, being tied to the center of excellence, the marketing has to center around that center of excellence. Master surgeons, this is your own standalone distinction and accolade. So you can really market however you want with that. You can market alongside the hospital. You can market your private practice. Maybe you're a hospital employee, but you just want to have your own website for personal branding purposes. We can assist you with that as well. And with that master surgeon flexibility, you are able to do that. So not only is it our highest accolade, you are receiving some big perks and benefits with that too.
And, we do understand specifically when it comes to marketing that it might be difficult for your hospital to partner with an external group like SRC to put marketing materials together. It might just be something that, is not in your standard process or that you're not comfortable doing. There's, on the other hand, a lot of groups who could use that additional marketing support that maybe they don't have an extensive team that's currently able to work with them. So we know that there are different challenges on the marketing piece, but like Larissa said, even if you don't feel that you'll be able to take advantage of us creating materials with you, we will market you as one of our centers of excellence. It's so important for us to know what's going on at your hospital. Like Larissa said, tell us your achievements or news so that we can put it out there to the patients that follow us and also to other healthcare organizations. You're always going to, have comparisons, right? And so you're helping show why you are distinguished with this accreditation through SRC, even if you can't utilize us on your side. On the surgeon piece too, I will mention that we see a lot of surgeons with their own social media pages now, Instagram, even TikTok. And so as a master surgeon, if you are looking to grow that following to get that patient awareness of you and what it is that you're doing differently, master surgeon is the way to go so that we can provide that support to you.
Absolutely. And to kind of go with Alex's point there, we are very familiar with working with extremely large hospital systems and very robust marketing teams, all the way down to clinical nurses who are also the social media specialist at a small private practice. So it is really kind of, again, going back to that needs assessment, how do you want us to support you? Whether that's just a check-in to see what we can do periodically because you have a team and a specialist in all the areas, which is fantastic. Or if it's maybe you want us to have eyes on something you want to put out, provide you some messaging so you don't have to reinvent the wheel, right? Or maybe just kind of high level strategy kind of a thing. So we really do it all. We do everything from, again, like the marketing plans. We will provide you a complete marketing communications plan from what we are seeing. And the nice thing about us doing this is just like we're a third party organization, we as healthcare marketing specialists are coming to your website, to your social media and looking at it from a patient perspective, right? Because I'm not personally a clinician. So I'm going to look at it as like, if I was looking for this service, if I had a hernia and I needed care, am I going to be able to find it on your website? I think it's about 7 seconds that your website gets to make an impression before somebody jumps off and goes back to Google, right? So it's extremely important to take into account that patient experience, that user experience, and that engagement in those digital spaces. So we will be able to provide you some unbiased feedback on that. We do provide press releases, and we do have templates for that to announce your accreditation, as well as we do a lot of custom press releases too with individuals to highlight specific things that are happening. Print and digital marketing. So this is where we're really going to talk about that cost savings. If you have ever purchased a video and video production, thousands of dollars, okay? Thousands of dollars. We actually do create video for you. There's one caveat, like I can't fly all over the world and shoot your video, but I will work with you on a script, on a shot list. iPhones these days are phenomenal. We'll talk about how to hold it, what to do, what lighting. And then we do have like voiceover actors we work with. So we take all these pieces and then we create this really nice, impactful video for you. And I do invite you to check out our YouTube page so that you can see some examples of those videos. As far as print goes, we do everything from business cards to billboards and everywhere in between. Social media is a huge piece that a lot of our designees want to work on. And so we are helping to create not only content for them, but we are also helping to plan out and help them bolster their campaigns, right? And to really truly make that something. I'm a big fan of not pushing content for content's sake. So we are really here to kind of help you push that to the next level and have it be not only relevant, but create a big splash around your accreditation. And as you should, it's a huge achievement. Physician referrals. So, like Alex said, not everybody wants to grow their referral base, and that is fine. But many do. And so we can help create pieces both on the digital atmosphere. Maybe it's you want to start a physician newsletter to send out to your current networks, and we can help you design that. We can help you with content for it, as well as print literature. On the video note, one thing that's becoming more popular is provider to provider videos. So we're actually creating videos where the surgeon themselves are introducing themselves, their patient care philosophy, their collaboration of care efforts, and then that's actually going specifically out to their provider networks. So it's kind of like, I know you and feel comfortable referring to you before I've actually gotten a chance to meet you. We offer additional marketing services as far as reputation management and consulting and how to really engage in that digital space. So what you're doing with your SEO, how to enhance your Google reviews. It's about 70% of individuals that are now going and flocking to the internet, flocking to social media, Googling to make sure that they're getting the highest quality of healthcare. And if you don't have that out there, you could have the very best in what you do and it wouldn't make a difference, right? It's the tree that fell in the woods. So really looking at that digital footprint, as well as how to respond to both positive and constructive feedback. I'm always a little skeptical of all 5-star reviews. You know, it's okay to have some constructive feedback because it shows, you know, real people are writing these things, and it's really about how you respond to that and how you change that messaging and fix that patient experience, right? So we can help with that as well. One piece that gets overlooked is the internal marketing, and this is huge. This is where you just have to start because you can't have this external messaging if not everybody internally is on board, right? And internal marketing is a multi-factor benefit here. So not only are you making sure everybody is speaking the same language when they're talking about the accreditation, it also helps everyone understand their role in this accreditation. Like Alex said, it's a culture shift within the organization, and everyone is a part of that culture. Everybody helps uphold and expand that culture. And so you're going to be boosting morale and bringing people around and rallying the troops with this too. So one way that we help with this is that we do provide staff info sessions so that we can, and it's not just for the surgical team. I want to note that this is anyone who's going to be patient facing, provider facing. It is for everyone. So we can help you really educate your staff on what goes into a center of excellence, feel and foster that sense of pride of being a part of a center of excellence, and make sure that we don't have any like missed opportunities. When we don't feel what I like to call confidently competent about something, right? Then somebody asks us a question and we kind of give that bare minimum answer and they kind of like, please don't ask me follow-up questions. So we don't want that to happen. We want to make sure everyone feels confident having a discussion around what a center of excellence, what a surgeon of excellence, what it means that Dr. John Smith is a master surgeon. What does that mean? So we will help you provide that to your staff as well.
Another benefit that I didn't mention when I was talking about what our designees have reported to us is that we have heard from many of our centers of excellence that they had a better time recruiting staff because they found that people preferred to come work at a facility that's accredited as a center of excellence. Again, they know that as a hospital, you're pursuing this standardization, that you have these processes in place already, that you're continuously wanting to improve. You're not going to sign up for this accreditation if you feel like we're already the best we are and we have nowhere to go from here. I mean, yeah, you're going to get recognized, but what's next? There's always the next step for you. So this piece, this staff education really ties into that. We understand completely the challenges right now, even of staffing at hospitals. We want you to not only recruit the best, but also be able to retain them. And this marketing piece is the first step to that. The second step is the other services we offer, like education. You know, if you have your inspection with SRC and our facility assessor lets you know that something they recommend is that you improve on your instrument sterilization, let's just say as an example, you know, if you don't know what to do with that recommendation, SRC will come do it for you. If you say, well, I wouldn't want an in-service on that soon because if we're not doing that properly, I want everyone to know what that means, what they can do to help, then we'll plan that with you. And SRC can be the group that actually comes in and does the education on your behalf to your team.
Right. So the next service we're going to talk about is our quality improvement service, and specifically our quality data analysts and our outcomes databases. This is another huge benefit and cost savings to you because we are going to be able to provide information in real time on your specific cases and things like that, that you're really going to be able to see trends and where those costs are. So as an unbiased third party, we are able to have that bird's eye view, right? I really do talk about that it is a luxury to be on the outside looking in because we're not in the nuances of the day to day. So when we're reviewing your data, and again, you know, complying with all private patient laws or privacy laws, we are not going to look at any specific, you know, patient names, anything like that. We are going to have it all de-identified, so no one's going to know that, but we are going to be looking at the information that you provide as far as outcomes and complications and readmissions and things like that. And we are going to be able to look at that objectively as not a part of your internal structure, and then provide feedback on things that we find, for example, like trends that we may be seeing or areas and opportunities for growth in certain things. Highlighting exceptional service achievements, you know, like, hey, you guys haven't had a readmission this entire quarter or something like that. You know, we're going to be able to help you celebrate those too. One of the very unique things that a lot of hospitals do have an EMR system, so they can get some of that data internally. But what our outcomes database allows our designees to do is to actually benchmark and compare themselves across other designees in that specific field. So within the US, you can see how your center of excellence measures up to other centers of excellence, or internationally, you can do the same thing and see how your data and outcomes are measuring up to other accredited bodies internationally. Medical tourism is kind of on the rise. So this is really, really important to keep in mind too, because as you're trying to pull from areas that are not just naturally within your own geographic zone, being able to showcase this is huge. We do provide customized reports and to track your data that are important to your goals. So again, just like marketing, we're going to find out what you want to focus on. What areas have you defined as a need or a gap or something like that? An example, you know, might be looking at patient outcome trends with similar comorbidity diagnoses, right? So that might be something that you want to kind of target.
And not only are those obviously customizable, but of course on demand as well. So if you have a planning meeting coming up and you need a nice presentation to show last quarter's information, or if you're budgeting for next year and want to talk about, you know, let's look at how our outcomes have improved and costs have gone down on that side of things, you can contact our quality improvement team and they will put that together for you to present at your internal meetings.
So before we talk about this slide here in the process of getting started with our outcomes database, please use that react button again, and let's use the clapping emoji if you love paperwork. If that's just you get up in the morning, you're like, I can't wait to get an Excel today. It's not me. I'm not a paperwork lover. I'm a thumbs down on that. It's a necessary evil, but it's not like my favorite thing to do every single day. And I'm seeing one person who loves it. That's fantastic. I hope that they have you doing some amazing things with that. Many of us are not. It's sort of, paperwork is the necessary evil, but it's not the light of our life. So you do have to submit your caseloads upon initial accreditation. We really can't get around that, and that is the paperwork. But by submitting your caseloads, we will put that into our quality system as well, and that becomes your baseline measurement, right? And then with that, if you continue to utilize the outcomes database, not only are you going to be able to have real-time access to pull these trends and data and look at it internally without waiting for an SRC individual to, we can of course provide you those benchmark reports, but you'll be able to have access to that too. So if it's Wednesday at 5 o'clock and you're like, I just wonder what this week looked like, and you want to get in there and pull one, you can totally do that. If you are continuing to put that in, then when 3 years come around for your compliance inspection, half the battle is done because you are already going to be putting in that data. You're not going to have to send additional case volumes because it's already going to be right there. We can already see it right there and analyze it there. So that whole paperwork conundrum is just sort of a moot point for years down the road. But you do have to enroll in the comes database to be able to achieve that benefit. So again, like Alex was saying, you do have to engage and take advantage of the services.
Yes.
And why wouldn't you? They are gratuitous, right?
And I will tell you all that our team has a lot of experience working with different EMRs, and we are happy to set up a bulk import of data on, let's say a quarterly basis, however often, so that again, this is not meant to be more work or manual work for you in order to participate in this quality database. We want it to be simple. We don't want you to think about having to have an FTE assigned to entering data. That's the opposite of what this is about. So as you go through your initial inspection process and you pull that first case list for us, we will work with you to determine the best way to automatically get that data on a regular basis into the quality database, and therefore allow you, like Larissa said, to do that real-time access of scorecards and reporting, and then make your future inspection processes simpler.
And just the last thing that I want to show you is what our benchmark reports look like. So we do create these in a couple different ways so that you can easily see the data. It's not kind of like hunting to try to figure out what this means or that means. But we can also take this a step further. So it's fantastic internally to be able to see all this data. But again, let's make some noise when that tree fell. So our marketing team can actually help you take these benchmark reports and this amazing data and create unique designs and copy so that you can share this externally, right? You can share it with your provider connections, you can share it with patients, you can create social media campaigns and really showcase that we aren't just talking the talk, we have proof that we are walking the walk as well.
And this benchmark report we can do on different levels. When we have a health system come to us and pursue that network of excellence accreditation, they might want to benchmark to other networks of excellence, right? You want to know how you're doing compared to others that are similar to you. So it can go from the top at the health system all the way down to on a surgeon level. Within our Center of Excellence Accreditation, you can have an unlimited number of surgeons participate in becoming surgeons of excellence. And if, we encourage the more the better, of course. So if you get to the point where you do have all your surgeons participating and we're seeing their data compare, how much surgeons, I know we have some surgeons on here and healthcare people, so that competition is a driving factor for you. So we can create those reports, even, some help with dashboards that you do so that you can have a quick peek at how your surgeons are performing.
So we go ahead, Doc. No, Alex, go ahead. No, good. I was going to say probably exactly what you were going to say.
Yeah, well, we wanted to make sure to leave some time for some questions from the group. And so what we're going to do is in the chat, you can go ahead and type a question and we'll address it. If for some reason you're having any issues typing in the chat, if you raise your hand, we can unmute you to ask the question. I know some people might be, traveling or not really sitting in front of a computer during this webinar. So we're going to open it up now. I also want to mention on the screen here, we have information for our business development team. And if you scan that QR code, it'll take you to a form that if you complete it, you'll get sent right to someone from our business development team. Some of you on the call may already be in contact with one of our business development representatives. And so after this call, if you reach out to them with any questions, or if you say, I'm ready to move ahead, let's take the next step, they'll continue to help you with that. So again, just in our chat, please let us know any questions that you have after seeing all of this information.
Alex, I do have a question for you.
Okay.
Paul is asking, we are a smaller hospital with limited bandwidth to handle everything involved in the accreditation process. What do you recommend in this instance?
So actually what we do for our groups that are having challenges with putting the documents together and actually just finishing that inspection process, we can offer a service for that. We have one of our clinical experts that are able to, in fact, come in person to your facility and just kind of sit down and say, here's the information I need. If you can provide them with just one person to pull some data, pull some policies and documents, they will not only help you put together the documentation, but also complete the inspection at the same time. There is an additional fee for that kind of service, but I can promise it is nominal compared to some of those external groups that offer these, consultative support services for achieving accreditation. I know there's a lot of that out there specifically for some other accrediting bodies. What's nice, like I said, with SRC, we'll help you ourselves, and then you're successfully completing your inspection at the same time.
And we did have another one. Is it possible to share the slides and recording? Yes. Since you have signed up and we have your email, you will be receiving the recording and you can save that or watch it over again, share it. Absolutely. We'll be sending that to you.
One question, a frequently asked question that I'll just address in case someone's not thinking of it on the top of their mind, is how long does the process take to become accredited? So, we actually put most of the timeline in your hands when you decide to pursue accreditation. You control a lot of that. We recommend certain timelines during that process. So once we receive your payment, as I mentioned, that's when you can actually begin the inspection process itself. We recommend that you take 90 days to submit your documentation. And again, that's the first piece of that inspection process, right? So if you can get your documents into us within 90 days, we'll turn that back around, review it, request those charts that I mentioned and turn that back around to you fairly quickly so that we can then plan that in-person facility assessment not long after that.
From marketing, one of the questions that we get a lot, because we are providing a lot, right, is how much is this going to cost me? You will never have a hidden cost. There are a few things that do carry a cost to it, like if we were to do a complete website revamp or new website for you, just because of how robust that project is, right? But as far as things like the brochures and designs and things, how this really works is that we will create or partner with you to create or just provide strategy depending on what your marketing structure is and how you want us to serve you on that. But if you want us to create the design, we will create that for you. We will send it to you in the print ready format. You can then utilize your own local vendors to have that printed, or you can go through our vendors and have that printed and shipped to you. But the printing costs and that full production, that does become a cost that you would pay for, but the design is included, which saves tons.
I
And
think
oh, sorry, Alex, go ahead.
Just, it is really important to not think about this as another award that gets hung on the wall, because that doesn't really do anything for you. If you came around to us in 3 years and said, yeah, I got all my seals and that's all I ever did, I would understand if you didn't want to continue with our accreditation. We actually have a very high retention rate. last report might have been about 98% of our designees maintain their accreditation year over year. And the reason is they take advantage of the designee services. And so we, at whatever level it is that you can or want to use, we're here to help with that.
Absolutely. Got some other questions. Anyone else? And you can absolutely, of course, scan the QR code, call, email us if you have questions later down the road, or you want to share this recording with your coworkers and they have questions. We are here for it.
If there are not more questions, we will let you go. I know we had this scheduled for an hour and we perfectly hit that number right now. So like Larissa said, please contact us, scan the code, but you will get a follow-up with a recording of this if you want to share it with other team members, watch it again, or just as a reminder to say, oh, yeah, I did want to contact someone there. We'll get this sent out to you soon, and we really appreciate you all joining us today.
Thank you, everyone.